Hi, my name is Prasuna Gullanki. I am a freshman here at University of Florida in the master's program, and today I will be talking about opioids and opiates. So, opioids come from a natural compound called opium, and this compound is used to make things like morphine, right here, and codeine and threonine that can be used for pain management. Opioid drugs bind to GCPRs, right here, which are G protein coupled receptors. So when opioids bind to GCPRs, they bind to the extracellular side of the receptor. So this green bubble is what we're looking at. There are three main subtypes of GCPRs that opioids bind to, each with specific side effects. So the mu subtype is morphine preferring, meaning it mainly binds to morphine and is the most commonly used receptor for clinical drug testing and administration. The mu subtype has side effects that include analgesia, which is the inability to feel pain, euphoria, which is extreme excitement and happiness, and GI effects such as constipation and many more. The next subtype is a kappa subtype, which also helps with analgesia but has dysphoric side effects, unlike the mu receptor. And the third receptor, the delta receptor, can mediate effects like analgesia and convulsions, kind of like seizures. And the delta receptor also aids in the tolerance of opioids. So there are two main things that opioids target in the synapse. So we're looking at this picture down here. The first thing they control is potassium channels in the postsynaptic cleft, so down here. By hyperpolarizing potassium channels, the synapse has a smaller reuptake rate of neurotransmitters. The second thing they target are calcium channels in the presynaptic cleft. So up here, they work by inhibiting the opening of calcium channels, which in turn decrease the amount of neurotransmitters being released. Again, this means that the neuron is going to be less active. So, with a combination of decreased neurotransmitter release along with decrease in the number of potassium channels that are open, there is little to no activation of pain receptors when using opioids. Um, Many people misuse opioids for their euphoric effects, but one of the biggest side effects with opioid use is decreased respiration. So, when you have decreased breathing, you can have an excessive accumulation of CO2 in the body, along with decreased amount of oxygen reaching the brain, both of which can be fatal. One of the ways to reverse opioid overdose is by using Narcan. Narcan is a nasal spray that consists of a molecule called naloxone. So this picture right here, naloxone will kick the opioid molecule off the receptor and allow for proper flow of molecules again. This will primarily help the person breathe normally again and will work anywhere from 2 to 3 minutes of this nasal spray being administered. So as opioids have changed the face of pain management in the medical field, they are just as dangerous and should be used carefully. Thank you for listening.